many of the things that we do, a mask gets in the way. So we've addressed that. We've installed HEPA filters. These are super filters that vacuum out viruses. We've installed them in the rooms where we do treatments. For instance, if we're doing a Botox or filler treatment around the mouth, we can put you in a room where there's this filtered air, and that reduces any sort of possible transmission from one patient to the next coming in. So we've done things like that to really reduce the risk. So I think as an office, we take it seriously. We've screened everybody who comes into the office, whether it's the staff or the patients, are temperature screened as they arrive, and we do discuss possible symptoms or exposures with every patient. We find out if family members recently had COVID, and if so, we ask them to come back maybe a week or two later when things have settled down a little bit. So we've really tried to address the potential risks of COVID. And, I think this is going to be a long-term thing. We're, 6 months into it. We're probably going to be wearing masks for another, at least another 6 months to some extent. And even long-term, we'll probably think twice about doing treatments around the mouth and not wearing masks. Even long-term things like the flu, things like that might be a possible transmission. So we're probably going to be wearing masks for a long time when we do some of these treatments.
Now, what would you say to a patient who might feel still not comfortable visiting the office, even when we are?
Well, one thing that we've embraced is telemedicine. And really from the start, we've done telemedicine. And what this means specifically is we're able to interact with patients over the internet. So using their computer, using a camera, we can examine the patient in many cases and at least interact with the patient. And we've done a number of initial consults. And we've also done many follow-up visits. And many of our patients, don't live in Lewisburg. They have a bit of a drive to get here. And a simple follow-up visit is actually very easy using the computer. And it saves them time. It saves them certainly driving time, and saves them any, possible risk of exposure by coming into the office. So we're able to do that. We've embraced that. We have excellent technology in order to do that sort of patient interview over the computer. Every room we have actually has a computer screen and cameras and that sort of thing. So we can literally do the consult or the follow-up visit right over the computer and from the safety of the patient's home.
Mm-hmm. And what sort of precautions are you taking for surgical patients who are more susceptible to viruses and germs during this time?
Sure. So really the standard, at least right now, has become to test people for COVID a few days before their surgery. So when the surgery is scheduled, we'll actually plan a time a couple of days beforehand and arrange a COVID test. And that's because if you're having anesthesia, there are really some unknown risks of having COVID at the same time. So the safest approach to this whole process is to get a COVID test beforehand. And then we encourage the patients to do those safety things before the surgery, like socially distance and avoid interaction with other people and all those potentially dangerous things that could expose them to COVID right before the surgery.
Mm-hmm. And now, what would you say to patients who might be a little weary of a vaccine that is supposed to be available to everyone, hopefully within the next few months, coming this next year? Hopefully by the time this podcast is released, we will have a vaccine available to all. What would you say to those who might be weary of a vaccine for a virus that we feel like we're learning something new about every day?
Right. Well, I think medically, I think the risks of the vaccine are much outweighed by the risks of coronavirus. So it seems like the risks of the vaccine, in the tens of thousands of people who it's been examined in have been very small. So personally, I'm embracing the concept of a vaccine. I'm eager to get the vaccine. And I would encourage patients to, consider the vaccine. I think long-term, again, the risks of the vaccine are going to be so small that they're much outweighed by the risk of getting coronavirus.
Mm-hmm. Yeah, good. So for those patients, again, who aren't comfortable visiting the office, we do offer the telehealth option. If you ever have questions or anything, feel free to call us or message us through our website and just discuss what sort of options we have for appointments for patients who don't feel like physically visiting the office. other than that, I think we pretty much covered it.
Yeah, I think patients should be encouraged to call or email. Our staff is very happy to chat with folks or email over the phone. So if you have any questions or if you're contemplating something, give us a call or an email, and we're happy to discuss it with you.
Yeah, great. That's a wrap on this episode of the Beautiful, Confident, and Safe podcast, brought to you by Lewisburg Plastic Surgery and Dr. Normington. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery, please visit us online at lewisburgplastic.com or find us on Facebook at Lewisburg Plastic Surgery and Dermatology or on Instagram at Lewisburg Plastic. We'll see you next time.